Most fixed-site jobs in buildings, factories, and warehouses expose employees to hazards when they work by themselves. When this is the case, a plan or work-alone policy should be followed. An employee is considered as working alone if they are working by his or herself such that assistance is not readily available should some injury, illness, or emergency occur. First, a hazard assessment needs to be done to evaluate the risks of working alone and identify control measures. The following steps can help provide a safe environment for employees working alone or in isolation. Identify all positions that require employees to work alone. Understand all the hazards associated with each position to ensure they can be reduced or controlled. This includes both the working environment and work procedures. Repeat this hazard assessment on a regular basis because hazards can change over time. Communicate this assessment to both management and employees. Train workers to be aware of their surroundings. In high-risk jobs, consider a mandatory policy that employees must work in pairs. Establish check-in procedures. Employees can stay in touch through cell phones, radio, panic buttons, or buddy systems. The regularity of checks will depend upon the hazards and risks identified. Safe work procedures. Having written safe work procedures for hazardous work is necessary. Equipment safety. The employer must ensure that workers use equipment as intended and according to the manufacturer's design limits. All equipment used in a workplace must be maintained in good working condition, whether or not it is being used in a working alone situation. Equipment and supplies. In addition to proper equipment, first aid and emergency supplies must be provided to workers who are working alone at a work site. If workers are working alone in a remote location, the employer should establish a sign-out procedure to track their whereabouts. An overdue employee procedure should also be in place for locating workers who fail to report on time. Although OSHA does not have a specific requirement to implement a work-alone policy, failure to have a policy could be considered a general duty OSHA requirement and has been cited by OSHA in the past under the General Duty Statute. An employee is considered as working alone if they are working by his or herself such that assistance is not readily available should some injury, illness, or emergency occur. True or false? Employees must be physically fit to perform their job function and receive proper training for the assigned task. Safe work policies and procedures must be followed. Report to work fit for duty, unimpaired by alcohol, drugs, or fatigue. An individual is fit for duty when he or she is neither mentally nor physically impaired from any cause that could affect job performance. These impairments could be the result of over-the-counter medications, physical illness, mental illness, substance abuse, mental stress and/or fatigue and contributing factors to decreased mental alertness. Fatigue affects everything we do, physically and mentally. When workers are fatigued, they are unaware of how badly they are performing. Employees must inform their supervisor of any over-the-counter or prescription medication they may be taking. Workers who report for duty or are on duty while knowingly impaired may face disciplinary charges up to and including termination. Pre-employment, random, and post-accident drug screenings are mandatory. Refusal to submit to a test may result in termination. Use of alcohol and drugs are forbidden on the job site. If an employee is found to be under the influence of a mind and body-altering substance, that employee will be removed from the job site immediately and be subject to termination. Supervisors must regularly observe the activities of workers on site to determine if they are under the influence of drugs or alcohol, are impaired due to illness, or are suffering from the effects of fatigue. Notify your supervisor immediately if there are any conditions that may affect your ability to safely and competently perform your duties. Employees don't have to inform their supervisor of any over-the-counter or prescription medication they may be taking. True or false? Research reveals shift work in general creates fatigue risk. Shift work has been associated with gastrointestinal and cardiovascular complaints, type 2 diabetes, breast and prostate cancer, and depression. Shift workers aren't the only types of employees who are susceptible to fatigue. Other factors contributing to fatigue include time elapsed since last sleep and the length of last sleep. Unusual work shifts can be more stressful physically, mentally, and emotionally. Non-traditional shifts and extended work hours may confuse the body's regular schedule, leading to fatigue, stress, and lack of concentration. These effects may lead to an increased risk of operator error, injuries, and/or accidents. Fatigue is a message to your body that it needs to rest. Some factors that can lead to increased fatigue include overnight shifts, high risk and repetitive jobs, a lack of regular rest periods, work sets that extend beyond the industry standard, failing to take time off at regular intervals. Supervisors must recognize signs and symptoms associated with extended and unusual work shifts. Workers who are being asked to work extended or irregular shifts should be monitored for the signs and symptoms of fatigue. Any employee showing such signs should be evaluated and possibly directed to leave the active area and seek rest. Some of the most common symptoms of fatigue include weariness, sleepiness, irritability, reduced alertness and/or lack of concentration and memory, lack of motivation, increased susceptibility to illness, depression, headache, giddiness, loss of appetite, and digestive problems. To effectively manage fatigue, have periodic assessments of staffing levels to ensure that work hours are reasonable. Take into account production demands, workload fluctuations across shifts, weeks and months, and planned, unplanned outages. Fatigue management training for employees, their family members, and supervisors to help them recognize signs of fatigue and create awareness of the need for uninterrupted hours of sleep. Sleep patterns at home impact work performance. Analysis of work environment and conditions, with focus on the effects of lighting, bright lighting where possible, and indirect lighting to minimize eye strain. Individual risk assessment and mitigation. Employees are encouraged to be aware of their own and their coworkers' fatigue levels. Call for programs to address sleep disorders. In addition, supervisors have authority to take appropriate steps to ensure employees are fit for duty. Investigate the degree to which fatigue plays a role in accidents and near-miss incidents. Factors to consider include the time of the incident, shift pattern, number of consecutive shifts worked, number of hours awake, and number of hours slept in the last 24 hours for individuals involved in the incident or accident. Extended shifts should occur only to cover unplanned open shifts or safety-critical tasks. Periodic assessments of effectiveness and identification of opportunities for continuous quality improvement. Targets should be established and performance measured in key areas such as percentage overtime, number of open shifts, number of extended shifts, and number of exceptions. Workers must report fatigue to supervisors so they can take appropriate action to assist the workers. Which factor does not lead to increased fatigue? A lack of regular rest periods, boredom, high risk and repetitive jobs, overnight shifts. Factors contributing to fatigue include time elapsed since last sleep and the length of last sleep. True or false? Exposure to freezing and cold temperatures for long periods of time may cause serious health problems such as trench foot, frostbite, and hypothermia. In extreme cases, including cold water submersion, exposure can lead to death. Trouble signs include uncontrolled shivering, slurred speech, clumsy movements, fatigue, and confused behavior. If you observe any of these signs, call immediately for emergency help. Factors that contribute to cold stress include cold temperatures, high or cold wind, dampness, and cold water. A cold environment makes the body work harder to maintain proper temperature. Recognize the environmental and workplace conditions that may be dangerous. Learn the signs and symptoms of cold-induced illnesses and injuries and what to do to help employees. Train employees about cold-induced illnesses and injuries. Encourage employees to wear proper clothing for cold, wet, and windy conditions, including layers that can be adjusted to temperature changes. Be sure that employees in extremely cold conditions take frequent short breaks in warm, dry shelters to allow their bodies to warm up. Try to schedule work for the warmest part of the day. Avoid exhaustion or fatigue because energy is needed to keep muscles warm. Work in pairs so that one employee can recognize danger signs. Drink warm, sweet beverages, sugar water, sports-type drinks, and avoid drinks with caffeine, coffee, tea, sodas, or hot chocolate, or alcohol. Eat warm, high-calorie foods. Risk increase when employees take certain medications, are in poor physical condition, or suffer from illnesses such as diabetes, hypertension, or cardiovascular disease. There are several things you can do to keep warm and prevent cold weather-related illnesses. The first thing we want to do is to keep your body temperature at or about normal, 98.6 degrees Fahrenheit. This can be accomplished by wearing layers of clothing both inside and outdoors. Always wear cotton or lightweight wool next to the skin and wool layers over your undergarments. Keep dry by having proper rain gear available and a pair of good waterproof boots. An extra pair of clean, dry socks can really come in handy. Do not forget to protect your neck and ears. You can lose a lot of heat from these two areas, and a good pair of gloves is essential. It is obvious that below freezing conditions, along with inadequate clothing, could bring about cold stress. It is important to understand that it can also be brought about by temperatures in the 50s, coupled with some rain and wind. Exposure to freezing and cold temperatures for long periods of time may cause serious health problems, such as trench foot, frostbite, and depression. True or false? A cold environment makes the body work harder to maintain proper temperature. True or false? Often, work is to be performed in hot environments for long periods of time. When the body is not able to maintain a normal temperature, heat-related illness can occur and may be deadly. We will look at ways to guard yourself from heat illness, as well as measures your employer should take to prevent heat-related illness and death. Let's look at some of the factors that will increase your risk to heat illnesses. High temperature and humidity. Direct sun exposure with no shade. Indoor exposure to other sources of radiant heat, such as ovens and furnaces. Limited or no air movement. Not drinking enough liquids. Hard physical work. Heavy personal protective clothing and equipment. Poor physical condition or health problems. Some medications, for example, different kinds of blood pressure pills or antihistamines. Pregnancy. Not used to working in hot environments. Previous heat-related illness. Advanced age, 65 plus. Heat stroke, Heat exhaustion, heat cramps, and heat rash are the most common heat-related illnesses. Heat stroke is the most serious heat-related health problem. Heat stroke occurs when the body fails to cool properly, causing the temperature to rise to critical levels. Heat stroke is a medical emergency that may rapidly result in death. Symptoms of heat stroke include confusion, loss of consciousness, seizures, very high body temperature, hot, dry skin, or profuse sweating. If a worker shows signs of heat stroke, while first aid measures are being implemented, call 911 and get emergency medical help. Make sure that someone stays with the worker until help arrives. Move the worker to a shaded, cool area and remove outer clothing. Wet the worker with cool water and circulate the air to speed cooling. Place cold, wet clothes or ice all over the body, or soak the worker's clothing with cold water. Heat exhaustion is the next most serious heat-related health problem. Symptoms of heat exhaustion: headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature, decreased urine output. If a worker shows signs of possible heat exhaustion, workers with signs or symptoms of heat exhaustion should be taken to a clinic or emergency room for medical evaluation and treatment. If medical care is not available, call 911 immediately. Make sure that someone stays with the worker until help arrives. Workers should be removed from the hot area and given liquids to drink. Remove unnecessary clothing, including shoes and socks. Cool the worker with cold compresses to the head, neck, and face, or have the worker wash his or her head, face, and neck with cold water. Have the worker drink cool water. If the worker is unable to drink, get emergency medical help immediately. Heat cramps are muscle pains usually caused by physical labor in a hot work environment. Heat cramps are caused by the loss of body salts and fluid during sweating. If a worker shows signs of possible heat cramps, replace fluid loss by drinking water and having a snack and/or carbohydrate electrolyte replacement liquids, for example, sports drinks, every 15 to 20 minutes. Workers should avoid salt tablets. Get medical help if the worker has heart problems, is on a low-sodium diet, or if cramps do not subside within 1 hour. Heat rash is the most common problem in hot work environments. Heat rash is caused by sweating and looks like a red cluster of pimples or small blisters. Heat rash usually appears on the neck, upper chest, in the groin, under the breasts, and in elbow creases. If a worker shows signs of possible heat rash, the best treatment for heat rash is to provide a cooler, less humid work environment. The rash area should be kept dry. Powder may be applied to increase comfort. Ointments and creams should not be used on a heat rash. Anything that makes the skin warm or moist may make the rash worse. It is important to immediately report any of the above signs and symptoms of heat illness. Inform your supervisor immediately. Now, some precautions to take that will prevent heat illness and supervisor's responsibilities. If shade is not available, your employer must provide shaded areas to prevent or recover from heat illness. There must be plenty of clean, cool drinking water on site at all times. All employees who work outdoors in the heat or in hot environments, and all supervisors, must be trained on the risks and prevention of heat illness, including how to recognize symptoms and respond when they happen. Supervisors must take into account the age, weight, and general health of workers before they are assigned tasks. All are factors that will increase your risk to heat illnesses except not drinking enough liquids, hard physical work, limited or no air movement, personal protective clothing and equipment. Heat stroke, heat exhaustion, heat cramps, and heat rash are not the most common heat-related illnesses. True or false? All projects should have clean lunch areas and clean drinking water made available in proper containers and with individual cups. Approved trash containers should be available to separate and properly dispose of discarded cups and other trash. Portable toilets must be provided at a ratio of 1 for every 20 workers on the project. Our transportation must be provided to proper toilet facilities that are readily available. We've covered a wide range of topics in today's video. Each part is just as important as the next. And we must work together to make sure safety is a top priority every day. Make it your job to know the safety guidelines and use them. Follow all permit requirements. And if you have questions, ask your supervisor. They have your safety in mind. Let's end this orientation where we started, saying one more time that we must all work together to follow safety rules and practice safe work procedures. That's called safety awareness, and it really does work.